Hello, welcome back to the Harmony Inspired Health podcast. Today we're diving into an incredibly profound and often overlooked topic, silent trauma and holistic healing. Many of us carry hidden imprints of trauma that affect our emotional, physical, and spiritual well-being, sometimes without even realizing it. Our guest today, Dr. Shahrzad Jalali, is here to shed light on how trauma is stored in the body, how it manifests in our daily lives, and how we can move through it to reclaim our inner peace and vitality. Dr. Jalali is a licensed clinical psychologist specializing in psychoanalysis, trauma resolution, and relational dynamics. She integrates depth psychology, somatic work, and existential meaning making to help individuals not only process trauma cognitively, but release it physically, emotionally, and energetically. Welcome to the podcast, Dr. Jalali.
Thank you. It's a pleasure to be here.
Yeah, thank you so much for all of the work you do and for coming here to speak about what silent trauma is and its hidden imprints that it can have on our day-to-day life. Can you start by sharing your journey? How did you come to specialize in trauma resolution and holistic healing?
Yes, it's actually kind of a funny story. So when I was in grad school, much like a number of my fellow colleagues, I didn't know what my calling actually was. I knew I really liked psychology and I wanted to work in the field, but especially when you are in grad school, do you get bombarded by so many different dimensions and categories of this kind of work that you get lost. You are a beginner, you are filled with imposter syndrome. And, on top of that, now you have to pick a career path, which makes it very difficult. But as I was going through this journey, I remember I attended a conference by a speaker who was actually talking about trauma. And when I attended this thing, obviously, I don't think I was even an intern yet. So in grad school, you have to take a bunch of courses first. And then eventually, when you finish your coursework, you become eligible to become an intern. But at that time, I wasn't even eligible to be an intern. So I was a beginner just taking courses. But I was sitting at a table with a bunch of, I want to say, seasoned psychologists at the time. People who had been practicing for many, many years. And the speaker came and kind of said his piece. As I said, the topic was trauma. And I was very intrigued by the conversation at the table. I thought they're going to start sharing their stories about their clinical work and kind of asking questions about how do we treat this condition in a patient and so forth. And then I noticed that they started raising their hands one by one and talking about their own personal trauma. So whether it was an accident or the loss of someone or something horrific that had happened throughout their life, or for example, some childhood trauma growing up, everyone was so immersed in their own personal experience of trauma. And that caught my attention, especially regarding the wounded healer archetype, where people come into this field to vicariously heal on some level. And so much so that I ended up doing my doctoral dissertation on this topic. But I think it shed light on the fact that at the core of a lot of psychological dynamics is unresolved trauma. And I decided to delve into the topic more and understand it better.
Many people associate trauma with big, obvious events, but what I'm understanding from silent trauma, it's more subtle. Can you explain what silent trauma is and how it manifests in our lives?
Yes. So to your point, most people have an understanding of trauma that it has to be some big life impacting event that happens to us. But unfortunately, I have to admit that none of us can escape a life without some form of trauma, which, as you referred to very beautifully, some form of at least silent trauma. As we go through our developmental stages, many things can be a traumatic experience for us. For example, a mismatch between the typology of a primary caregiver and the child could be a form of trauma. Let's say your mother is very touchy-feely, and let's say your typology as an infant doesn't necessarily respond very well to that kind of constant touch. That by itself creates an intrusive environment where your psyche or your body doesn't always welcome that dynamic that's being forced upon you, and you can't speak or, show your um, kind of contradiction with the matter. So that starts to impact your psyche in a way that now we can essentially refer to that as a traumatic experience that someone goes through. I want to say anything that makes our nervous system stay in a state of hypervigilance for a long period of time, that we don't have any form of either identifying it, getting out of it, calming ourselves, or receiving some sort of help, can be categorized as something traumatic for our nervous system.
Yeah, it's so interesting what you said about silent trauma. Like, I would never sort of come to that conclusion of, a mother over touching and her baby or over loving her baby in an appropriate way, I
Yes.
would assume, and that not being, accepted by the baby, but they're not able to communicate that. And if that, I guess, keeps going over a long period of time and leaves like these imprints in our mind or our subconscious mind. And from an Ayurvedic psychology perspective, we talk about samskaras, which are imprints left on the chitta mind, the subconscious. How does one even from that example understand that they have silent trauma? Like, what does unresolved trauma look like, or how does it impact our nervous system? And I guess, how do we recognize that this is silent trauma?
I think one of the best ways to go about this is when a patient comes to a clinician, for example, they look for a diagnosis, mostly because the diagnostic manual that we use to essentially, kind of treat patients with at this point inspires us to come up with a clinical diagnosis to treat, essentially. And that's how insurance companies categorize it. But generally speaking, client comes, you ask them questions, and let's say they say, I have anxiety, I have depression. The way we look at this from a psychoanalytical perspective is this is not necessarily this person's diagnosis, even if they meet all the clinical criteria for it. But this is a symptom that is showing up. So I am anxious because something in my body isn't functioning the way it needs to be functioning. I am depressed because something in my life, in my surroundings, in my psyche isn't unfolding the way I need it to. Now, keep in mind, I am not disregarding biological reasons for any of these diagnoses. Obviously, there could be many biological reasons, including hormones and so much more, right? But that aside, even with those diagnoses, we want to say there is a reason why you're feeling the way you're feeling, right? Now, if we pull on that thread, it usually takes us to, for lack of a better word, a trigger, something that has caused us to feel this way. At the core of that, if we continue building awareness around that, is usually an event or a group of events that have caused in a particular belief system for us. For example, the world isn't safe. I am not safe. And therefore, my nervous system operates in a state of hypervigilance in situations where I do feel unsafe and so forth. And that essentially is our cue to go further inward and unpack what is beyond that experienced state of being, both psychologically and physically.
And so, how does the unresolved trauma impact our nervous system? And what role does the nervous system regulation play in healing? I also know that you you emphasize somatic body work or somatic work in the trauma healing approach. So how does this all sort of play a role in?
Correct. The way they all kind of impact each other is, let's say I grew up in a war zone where I never felt safe. At any given moment, the people around me were scared, even though as a child I didn't have an understanding of the type of danger that it entailed, but I knew everyone around me would have a particular reaction. We probably saw people get hurt, learned to have a reaction to loud noises or anything that felt dangerous to me. So my body, after a while, and my psyche get conditioned to have a particular response to that particular event. So they learn that anything that feels threatening is danger. So anytime, even if I were to leave this place and go into a place that signifies safety for me, essentially, any kind of loud noise or anything that will replicate my experience of the previous space that I was in will trigger the same kind of response in my psychology and in my body. So sometimes people don't even have memory of the event. They say, oh, I was very young when I left the country. I don't remember ever being in a war zone. In somatic verbiage, we say the body remembers. So I may not have a cognitive memory of it, but my body will jump and will feel startled every time I hear a loud noise. That is to say that my nervous system continues to be reactive to this. So it continues to have the same response that it had while I was in danger. So you can imagine if you continuously put yourself in that state, the body and the psyche will eventually experience what we call burnout or inability to respond. So if it gets super prolonged, we go into a state of freeze because we try to flee a situation initially. So our cortisol goes up, we have a fight or flight response. But if there's no relief, if we have no way of rescuing ourselves from the situation, we finally go into a freeze response, which is even more heightened sense of danger than fleeing a situation, essentially. And from that space, what we have to do is we have to help the nervous system regulate and regain control through somatic work, as you pointed out, mainly to start feeling safe again, to have a different response than the one it has been conditioned to have.
And is that the way of the body or the mind trying to, and the psyche, trying to keep us safe by not remembering those traumatic events? And therefore it does turn into sort of a silent trauma because we're having these reactions and these responses to what only our subconscious can understand or know. But we're not consciously understanding that. Therefore, it's more of like a silent trauma because our body and our mind has a mechanism of trying to protect us.
It is a defense mechanism, like you pointed out. Essentially, I guess we survive our life because we disengage from a lot of the trauma that happens to us. If you work with sexual abuse clients, a lot of them who were sexually abused as a child don't necessarily have a lot of memories around it, or they may say, I remember myself being there, but I don't remember being in my body. It's as if I was outside of my body observing it. So there is a process that happens that we refer to as dissociation in psychology that allows us to kind of survive whatever it is that happens to us. Some of us continue to have some level of cognitive memories around it, and some don't. It can go either way.
Yeah. And so for those who are sort of suffering in more of that sort of silent trauma, they're not remembering the events, but they know something's going on, like something just doesn't feel right within them. What are some of those sort of signs and symptoms that someone is suffering from past traumas?
So it can present itself in many different ways, to tell you the truth. It depends on, I guess, your psychology, your life story, the way things have unfolded, your support system at the moment. Some people experience a lot of somatic symptoms, like they have a lot of pain in their body. Some people have, it manifests into even different types of autoimmune diseases. Some people say, I just feel like I'm always on the edge, or I'm anxious, or I'm nervous. Some people say I have a lot of anger. Some people say no matter what I do, I can't get kind of into my life story. It seems like there's always something missing, or I don't belong anywhere. So it can manifest itself in as many ways as you can imagine, depending on your particular nervous system, your psyche, your typology, and so many other factors, to tell you the truth.
And I guess that's when they come to you and they know that there's something going on because they're not feeling as happy as like they perceive normal, quote unquote, normal people should, or they feel like they can never make progress in life. And then they would come and seek that sort of support and I guess sort of dive deeper into where these beliefs may have manifest or where the pain in the body may have manifested if it's been excluded from any other medical cause. And then there's the people that they get stuck in that negative emotional loop due to past traumas that maybe they are aware of. How can we start rewiring our thoughts and emotional patterns so that we can start to feel better in our mind, in our body, and release some of those symptoms that are keeping us stuck?
I like to go about it from a very multi-dimensional approach. First of all, I'm a big believer of checking for organic causes in the body, because sometimes the solution is very simple. So I essentially start with a lot of referrals to different functional medicine practitioners, anything that I feel like would be a good fit for that particular patient. From a psychological perspective, I like to go a little bit deep in the first few years of life, the developmental stages, get a better understanding of where this person may have been wounded developmentally. And then from a psychological perspective, what I like to do with it is to help them navigate their narrative and their belief system. Sometimes, as you said, people come and they say, I feel stuck. And when you delve a little bit deeper with them, you notice that their inherent belief is success, for example, causes corruption. So if this is my inherent belief system, I'm going to sabotage my own success because I feel like if I become successful, I am going to get corrupted in some level, right? And that was just an example, but these belief systems can be very deep and they can really narrate our life path. So we kind of go about it from different, patterns, and then eventually try to identify if it is rooted in any kind of trauma. And if it is, we go to more bodily techniques to kind of allow the body to integrate this trauma and build a new narrative around it, so the psyche and the body can collaborate better into kind of incorporating a new belief system around the whole notion.
Beautiful. So you mentioned body techniques, the somatic practices. So just circling back to that, what are some practical somatic techniques that listeners can use to start releasing trauma from the body?
Different practitioners have come up with different branches of somatic work. I was trained under Peter Levine in this particular notion. And I would say if you're going to start somewhere, the best place to start is to start building some awareness around your bodily responses. One thing I've noticed about people, I like to pair emotions with sensations when I talk to patients. Like if they tell me I am feeling anxious, I say, how do you know you're feeling anxious? And they say, well, it's just this feeling that, and then they usually try to find it in their body. I don't know, my heart starts beating fast. And I say, okay, so tell me, what is the physical manifestation of anxiety that you associate with this feeling, right? And most people have a lot of difficulty pinpointing sensational experiences in their body. It's as if no one has ever taught us the basic vocabulary for sensational experiences. We have absolutely minimal awareness around what happens in our bodies. Even me as a psychologist, when I went through the training and they were bringing our awareness to the body and, how we house emotions and sensational responses, I was very confused in the beginning. I remember you would go through the training and they would sit you in groups and circles to kind of practice it. And I was lost. And even when I could find something, I was so overwhelmed by it that I didn't know. I was like, okay, now I can find this thing in my belly. What do I do with this? It's scary. I don't know what to do, and then I would panic even more. And then you learn to kind of sit with the sensations, maybe give them names, maybe get to know them a little bit better, maybe observe them as they move through your body, and then maybe find resources in your body for sensations that don't feel good or pleasant to you. Just to tell you the truth, identifying a sensational response as neutral, pleasant, or unpleasant increases our vocabulary immensely around what happens in our body. So that basic awareness, I would say, is the best place to start.
Yeah, and a lot of the time when we're experiencing some sort of trauma response, we think it's all up in our head because we are overthinking. Like if we're in a stress state where we're thinking about the stressful future events or the event we're in right now. But where we can sort of bring it back into the body, we know that's a way of being able to sort of control the central nervous system to some degree as well. And that's, I think, from my practice, why somatic practices work so beautifully. And I know in Ayurveda, we teach a lot of somatic practices to regulate the nervous system, such as Vedic breathwork techniques, depending on their individual constitution, and, daily abhyanga, where you're self-massaging the body with oil to really calm that central nervous system. And what I'm loving with what you're saying, and from, what we teach in Ayurveda, is it really is all about cultivating that greater sense of self and self-awareness. Because like you said, if we're not self-aware of how we're feeling, then it's really hard to move through that. So just being able to say, like, I am feeling what you said, unpleasant, or it's the way I'm feeling is pleasant, or it's just getting us to come back inside, come into our body, and to acknowledge how we are in that state. And so I love that your work includes all of this. It's not just about talk therapy and being up in the head and getting it out. It's really embodying all of it. Yeah, which is really, really beautiful. And I know that many people, I guess, and I don't know if this is true for you because of the area you work in, but a lot of people are really hesitant to face their traumas. So what would you say to someone who is afraid to sort of start this journey? They know there's this underlying thing within them that they need to release, they need to let go of. But then there's that whole fear. And I guess these might be the people that sort of push everything down for a really long time because they don't want to face that. Because facing the trauma means opening up old wounds, so to speak, and facing the reality that you need to move through.
That's a great question, because one thing that I see in my clients unanimously is I feel like we're all programmed by society, especially in the Western world, very much to override our emotional experiences. I mean, we have phrases that suck it up, get over it, move on. You can't just sit in it forever. Society does not endorse our right for us to feel our emotional experiences. In fact, there is a belief system around the fact that people who are successful don't sit in these uncomfortable emotions. They just kind of push them back and get over them. We can't get over emotions. This is an absolute myth. Whatever we don't deal with in the body comes back up with a vengeance. So if you have any kind of knowledge around this matter, is you learn not to override your emotional experiences. If you can at least learn the vocabulary to label them, maybe you don't have necessarily the means to target them in that moment or to resolve them. The goal of emotional experiences isn't to get resolved necessarily, it's to be felt. And once we start to feel something, it creates a movement that dynamic is no longer stuck in a place in our psyche or body that can cause harm for us in the future. It starts to move, and as something starts to move, healing happens in the sense that we start to essentially use our abilities as a catalyst to help that notion reach some level of resolution. By resolution, there are problems in this world that cannot be solved. For example, if you've lost a person who's dear to you, it's not like you wake up one day and like, okay, I'm over it, I lost this person. But what happens is when movement starts to happen, you start to renegotiate your truth with that dynamic. That yes, I've lost this person. Yes, this has been immensely painful to me. But yes, I continue to survive after this loss. And what does that mean to me and how do I show up? So essentially, there's just a lot of uncomfortable emotions that have to get faced and targeted. And it's opposite of what everything in this world kind of invites us to do, essentially.
And I think opposite to that, like I mentioned, some people, the way that they deal or don't deal with moving their traumas is to push them down because of the fear of facing them. And then there's that other sort of group of people that are constantly being pulled into that same cycle and want to revisit and want to talk about it and feel more comfortable staying stuck in the sort of victimhood of their trauma rather than trying to move through it. So what would you say to those people who are sort of feel like they're sort of stuck in this traumatic cycle?
A very good question. They are people who collude their trauma and they love being victims of their story. The story is bigger than they are. And what I help them do in this process is become bigger than your story. Because when you outgrow your story, you can redirect it. But to the extent that your story is bigger than you, it will dominate you. It will rule your world. And it's easy to be in that space, right? Because now you're a victim and victims have no responsibility. So there's nothing you can do. Someone has to hold you accountable to kind of learn how to, there's always something that can be done about something, whether it's physical, psychological, relational, emotional. The worst thing you can do about something that bothers you is to just continue to resonate with it and sit in it. We do have to do that to some extent in the beginning because it's overwhelming for us, but eventually we have to step out of it.
I think when you enter the world of trauma discussions, as we are, it's really evident that there are so many different forms of trauma and there's so many different forms in the way we respond to trauma. Mm-hmm. And so we can't take away from anyone that, oh, that trauma isn't as big or as relevant as someone who's gone through this. And their reaction or their response is, so different and maybe more catastrophic than the person who's gone through so much. And I think we can get into this comparisonitis with traumas and how we should present ourselves as well. And especially maybe for those who are have more of that perfectionist sort of personality, maybe the type A personality, who, can also be hiding behind that due to their own way of coping with traumas and stuff. So I guess with this knowledge of the very vast landscape of trauma and reactions and ways of dealing with it, is there one sort of final takeaway, one really important message that you would like to leave our listeners with in how they can step forward towards healing their silent trauma or not so silent trauma?
Yes, what I would say to them is if you're going through something that doesn't feel manageable, if life feels more taxing to you than it feels relatively essentially doable, if you find yourself in a state of distress or numbness or tension most of the time, and if you don't have the means to challenge that or to get out of it, it's probably alluding to the fact that something else is running the show, something in your unconscious that's potentially trauma related. I mean, I don't want to say everything that comes up like that is trauma, but there's a good chance it can allude to something like that. Whether you're type A and you just want to override it and you think you can conquer the world and there's no need to sit in it, or you're not type A and you over-identify with it and you let it define you, you can renegotiate the way you're going about this dynamic. And there is many, many resources out there that can essentially target what's happening and help you navigate it better and go about it in a way that's more conducive with your health and success. So don't settle for whatever your negative emotional experience is and find as many resources as you can to help you out of it, because there is no reason to suffer through life. I mean, there is some suffering associated with life, but life isn't all about suffering.
And so where can our listeners connect with you, find out more about you or work with you?
Yes, there is a website, Dr. Jalali and Associates, that they can definitely connect with us at. There are some basically online links that they can go to. Our Instagram is under Align Remedy. TikTok is under Dr. Jalali. And there is a Farsi Instagram channel under Dr. Jalali as well that they can follow for Farsi speakers. I have a book coming out in September 25 that actually talks about trauma and how to overcome it and how to renegotiate your truth in regards to whatever traumatic experience you have had in life. The book is called The Fire That Makes Us. So those are some interesting things that are happening on our end, and I will share our social media links with you. And I'd appreciate you kind of allowing your listeners access to all of that. Thank you.
Absolutely. Thank you so much for coming on and sharing your wisdom. And congratulations on your book as well. And I'll definitely put all of the links in the show notes so that, our listeners can connect with you and go grab a copy of your book when it is released in September.
I appreciate it. The pleasure was all mine. Thank you for having me.
You're so welcome. And thank you to all of our listeners. Until next time, honor your body, embrace your emotions, and step into your higher self.